The views and opinions in this program are not those of CISA 7 or Spectrum.
All right, good evening, everyone, and welcome to the December 13th regular school board meeting. We will kick things off tonight with roll call. Beth, if you could help us with that, please.
Good evening.
Here.
Here. Layton and Warren.
Here.
Welch.
Here.
Smith.
Here.
Vanden Heuvel.
Here.
Warren.
Here.
All right, all 7 board members are present. We are also joined at the table by Superintendent Steve Murley, along with members of his cabinet in person and joining virtually. We have 2 members of our Intercity Student Council that are scheduled to join us tonight. I see Greta Hansen from Southwest High School and Stephanie Rios from Preble High School. She might be joining us on the iPhone there, but we do have Stephanie and Greta with us tonight. And Stephanie and Greta, feel free to chime in. I'll do my best to keep an eye on the screen to engage you in the conversation, but other members of the board will keep an eye on it as well. If there's anything you want to add, I want to make sure that you feel like you're a part of the conversation tonight. All right, let's move on with Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, and then we'll wrap up our opening activities with our mission statement, which will be read tonight by Brenda Warren.
Thanks, Eric. We educate all students to be college, career, and community ready, inspired to succeed in our diverse world.
Thank you. All right, moving on to open forum. First is the Intercity Student Council report, and I'll hand it over to Greta and or Stephanie.
So for Good News from Southwest, we started our rehearsals for Mamma Mia, our winter musical, and NHS is hosting Trivia Till Dawn, which is the first time it's happened in 2 years. And Troy's House and Freedom House have many drives from multiple clubs for the holidays. And then for East, the Razzle Dazzle Holiday Concert is next Monday and is combined concert with jazz band, orchestra, and chamber singers. East FFA has a poinsettia sale last week. And East completed in the Northeast Wisconsin Finance and Investment Business Bowl and will advance to the state competition this May.
Thanks, Greta. Greta, do you know if tickets for Mamma Mia are still on sale?
They just started rehearsals, so I don't think that they yet are selling tickets.
Okay, we'll keep an eye out for that. Thank you very much. All right. Oh, there you are, Stephanie. Sorry, go ahead.
All right, I was having technical difficulties, but I do have the news for Preble as well as West. So for Preble, DECA did have a fundraiser for World Relief and World Relief Fox Valley, and they did help raise over about $387 for Middle Eastern refugees, which is a very awesome accomplishment that we were able to do for them. And then this week, we do have a combined toy drive between DECA, National Honor Society, Link Crew, Student Council, and FBLA. And all toys will be donated to Foster the Village for Children in Foster Care. This week, we also did have a Student Council blood drive, and we nearly reached the donation goal despite many deferrals. but we did reach a lot of possible save lives. And then we do have a senior advisory food drive challenge, which is collecting donations for the Freedom House and the Preble Hive. And then we do have a fellow Preble student who was able to raise $3,372,000 to support disabled American veterans. And that student was Brooke Hogg, and she named her softball derby home runs for veterans. And then for West theater production, The View from My Shoes was a very big success, and the play was actually created by West students, sharing their stories of loss, community, and hope.
Wonderful. Any questions for Greta or Stephanie? All right. Thank you, ladies, very much for the updates. Keep up the great work. All right, moving on then, for the public forum, we had 2 people register. One submitted a statement, which was sent to the board earlier tonight. And then we do have 1 person who's registered for a call tonight. So Josh, if you can get them on the line.
Hello.
Hi, Heidi, can you hear me?
I can. Can you hear
Thank
me?
Yep, thanks so much for taking the time to call in. If you could start by introducing yourself and giving us your address, and then you have 5 minutes to make your comments.
Okay. Thank you, Eric. My name is Heidi Peed, and I'm at 1611 Royal Crown Court, 54313. Good evening, everyone. I am calling tonight to talk mostly about the close contact quarantine. As you are aware, GBAPS is still monitoring the close contacts of COVID-positive students and quarantining them. As of today, you have 877 healthy students sitting at home in quarantine and missing out on in-person instructional time. Earlier this year, you had as many as 2,300 students quarantining at home at one time and missing instructional time. If I do simple math and give you the benefit of weekend days as part of a student's quarantine, so let's just say a student misses 6 days of school due to quarantine, and at 6 hours a day, again, being generous, 2,300 students times 6 hours a day times 6 days, that's 82,800 hours of missed learning. Now, my next question I ask is this: how many of these healthy kids quarantining at home actually turn positive and become sick themselves? Is our health team tracking this? I would think this would be a very important number to know in order to determine if CCQ is actually useful and worth keeping this many kids out of school. Since I can't find this information from GBAPS, I used Howard Swamico's and Waukesha's numbers. Those districts found that less than 5% of the students in CCQ turned positive, less than 5%. So again, going back to a peak number of kids out, maybe 115 of those kids turned positive, 115 out of 2,300. So 2,185 students don't get sick from this and are kept out of school for no reason, falling further behind. Is that really worth it? Is this what is best for the student? Especially with being out of school almost the entire year last year and 1/3 of the year before that, and knowing our kids are behind, is this really what we should still be implementing? At this point in the game, is this responsible? You also have to remember that no student in our district has died due to COVID, and all 100% of students are recovered. The second thing I want to touch on is the graph that I sent you all this afternoon. Hopefully you took the time to look at it. Again, this is something Alan McGuire put together. I consider him an expert on data analysis, and this is all information directly from DHS. He has analyzed all the numbers, adjusted them for school district size to make sure we're comparing apples to apples, and then put it in graph form to help all of us non-data people visually see and understand the information. This graph has 9 of the 12 surrounding school districts, including Green Bay. The main thing I want to point out is the trends of the graph, what the lines look like. the ups and downs and general shape of each graph representing a school district? Do you feel they look significantly different? Or do they pretty much look the same? Do they all follow a general trend? Based on this graph and looking solely at the curves, can you tell which schools are mask optional, which ones are mask mandatory, which ones have CCQ, which ones don't? Can you tell me which one of those graphs is GBAPS? I purposely left the names of the school districts off. Looking at the big picture, it really doesn't matter what strategies you have in place. Mask optional, mask K through 6, mask K through 12, quarantine, no quarantine. COVID is running its course, and it is running its course the same regardless of school district and regardless of what mitigation strategies you have in place. So ultimately, is it responsible and doing what's best for our kids to unnecessarily keep them out of school? I see quarantine is on the agenda tonight, so I am expecting a discussion on it. I am also hoping you will take action on it tonight and vote to end it, effective immediately. The data is clear and doesn't support CCQ. The benefits don't outweigh the burdens of keeping healthy kids out of school anymore. The needs of many outweigh the needs of the few. Thank you for listening.
Thank you very much for calling tonight, Heidi. We appreciate it.
Okay, thank you.
All right, carrying on the agenda then, we move on to the consent agenda. Are there any items on the consent agenda that someone would like removed? Andrew?
I'd like to remove H and I.
Okay.
Yes.
All right, so we're moving H and I down to number 4 for discussion. With that, do I have a motion to approve the remainder of the consent agenda?
So moved.
Second.
All in favor?
Aye.
Aye. Opposed? All right. Consent agenda is approved. Then we'll go on to number 4, items removed. We'll start with H, classroom charging stations. Andrew, I'll yield the floor to you.
Thank you. I have no particular objection to this. I see that it's using ESSER dollars. It's too large of an item to be, I think, in consent agenda for something that's not a routine renewable thing. So if we could just get a 2-minute overview on the classroom charging stations, Josh?
Sure. And actually, we've got our Executive Director of Technology and Information, Amy Sturks, virtual. She's been working on this procurement this fall. So Amy, go ahead.
Sure. Well, I picked up some of the great work that Josh left off here. We are asking for charging stations, 2 different solutions, one for our secondary and one for the elementary classrooms. At the secondary level, the purchase is they're called ADAPT4s. It's a smaller container that holds 4 rechargeable batteries. The batteries can then be taken out of that ADAPT4 container and brought directly to the student's desk, and the student can charge his or her device from that battery pack. So we no longer have kids having to walk down to the library to pick up a cord or swap their device out, and we don't have the cords laying across the floors as trip hazards. At the elementary level, the charging stations are called the Essentials, and they are requested in both blue and a custom Green Bay green. Classrooms, based on their need, will either have 1 station. The one and only station will be the green station. And if they request a second station, then it will be a blue station, so that the teachers can send students to different parts of the classroom without having a group really corral in one area of the room. These stations hold 16 devices, and they have modules in them that allow us to put a USB-C cord from the charging module to the device, so that the charging cord does not need to be wired. So wiring carts for us will be a thing of the past, which will save us a lot of human time and effort. And it frees up cords for if devices need to go home. We do not have to unwire carts. The devices can just go home with the charging cord that is already out of the charging container. Are there any specific questions I can answer?
No, thank you. I have no questions. I just asked for it to be separated and have a very brief presentation because of the dollar cost of the items. I think it's great.
Absolutely.
Do you want the same thing on the Zoom video?
Yeah, after we.
Oh yeah, we'll vote on this one first and then we'll go to that one. Okay, good point. So then I'd look for a motion to approve the purchase of the classroom charging stations.
So
Second.
All in favor? Aye.
I'm going to request a roll call vote. There should be
Okay.
a counted vote on big ticket
Okay,
items.
yep, absolutely. Beth, do you want to do that verbally or?
Yes, verbally, please.
Okay, go whenever you're ready.
Okay. Smith? Aye. Warren?
Aye.
Vanden Heuvel?
Aye.
Welch? Aye. Becker?
Aye.
McCoy?
Aye.
Leighton and Warren.
Aye.
All right, motion carries 7-0. And then Zoom video communications, either Amy or Josh, do you want to?
That's me. Amy's off the hook, I think, for the rest of this meeting. Yes, so what we're looking at here is actually Zoom phone. So it's the phone component that Zoom offers. When we went remote as a workforce, one thing that was sorely lacking was a phone system. Our phones only work when you're at our schools or in our buildings. And if you're not, then you're missing calls, right? Teachers especially had to communicate with families, and they were put in the awkward situation where they either need to use their personal cell phone or do some weird workaround online where the call's coming from a weird number. Also, our teachers especially and our student services staff found that communication with families was far more effective with SMS text messaging, which is not something we currently have the capability to do. So if they wanted to text their families, again, they were texting from their personal phones, which is obviously not really an ideal situation. So knowing that, we needed to look at modernizing a little bit, I thought it made sense to check out what Zoom had to offer, since that was their video conferencing platform anyways. And having those platforms together has certain advantages. For instance, we're already deploying the Zoom app, right? So we wouldn't need to deploy a soft phone client to our users. It would automatically show up. So we did a little proof of concept beginning in September. This was with our support center. So our support center is currently running on 50 Zoom phone licenses. Last year, we had asked people working the support center to get personal Google Voice accounts, and that's how we were kind of managing that. And that's obviously not ideal because again, you're dealing with strange phone numbers and things like that. Plus, a phone account is something that the district should be providing as a resource to its employees. We've had some really good success. It's very easy to deploy. The other advantage to the Zoom phone platform is it's all cloud-based, whereas right now all the infrastructure is inside our building. So we have switches and routers and things like that in our buildings, and we have to maintain and all of that stuff. When you move to the cloud, all that's kind of taken care of. So I started talking more with Zoom. We worked really hard on a negotiation here, which is kind of unique. It is a 7-year commitment, but it essentially gave us a year for free because of the length of the commitment. And what it also does is it leverages that ESSER money again, right? Because this is a response to the pandemic and a remote workforce, so it's an eligible expense. And naturally, we have regular phone costs year to year. So this is a case where the ESSER money being applied to this purchase is going to save us money in our regular Fund 10 going forward for the next 6 or 7 years. So it's I think it's a really great opportunity. I think the district is ready. I know our teachers want to be able to text their kids and their parents. So that's kind of it in a nutshell. Any questions for me? Go ahead.
As far as, do you have a rough ballpark about where we'll be with hardware for these? Because we'll want to do it right. I'm hopefully headsets and so forth.
Yeah, that's a very good question. So one of the drawbacks of our current system is that it uses proprietary phone hardware. With the Zoom phone platform, our proprietary phones that we have sitting on our desk won't work, but you can get all sorts of different makes and models from a number of manufacturers. So if this were approved today, we would be going out to RFP for the phone hardware. We'd be offering several different models depending on how phone intensive the job is. So a switchboard or a secretary is going to have, a nice big screen and with lots of buttons, whereas a classroom phone may be much simpler, for example. We do have some ballpark estimates there. I expect that to be probably in the $500,000 range for the hardware plus the services for configuring the phones and deploying them. We see this as a rolling deployment, maybe building by building. So we're going to run both systems side by side for a little bit. It's too big of a change to do all at once. But yeah, that's the plan. I'd be bringing a hardware RFP recommendation to you in January if this were approved tonight.
So you're thinking physical phone will be primary for the vast majority? It wouldn't be switching over to soft phone, or maybe it would for some people?
Well, we need physical phones for safety reasons, in a lot of places. I think a lot of people are going to switch over to soft phones. Right now I've got a demo phone in my office, and when I get a phone call on the Zoom phone, it rings my physical phone, it rings my cell phone because I have the app installed on my cell phone, and it rings on my laptop. I could be completely functional with just my laptop or honestly just my cell phone. So now my office desk phone is wherever I am, wherever I have access to the internet. So I do think it's going to result in fewer physical phones, but in many cases, especially in school buildings, the phone is there primarily for a safety. If someone needs to call 911, we run our paging systems through the phones and things like that. And this does integrate with paging and intercom.
And then they'll be able to port numbers in and all that. So there won't be changes of phone numbers.
That's right. We'll be keeping the phone numbers, and we'll be keeping extensions that should be seamless to our users.
And just in case someone's watching and not familiar, when you talk about your cell phone, you're talking about something that is completely separated from, it's an app that has nothing to do with your personal cell phone number, of course.
Yes, that's correct. So if you've ever joined a Zoom meeting on your phone, it's that very same app. There's just another tab that shows up that says phone. And then if you were to make calls or take calls, it would be from and to your work phone number. Same with text messages.
Thank you. That's helpful. It's a big change, so I just wanted to get a little more information out there on it. It's a good find. It's a good cost for that term.
All right, unless there's any other questions, I'd look for a motion to purchase the Zoom video communications.
So moved.
Second.
Any other questions or discussion? All right, we'll take a voice vote, Beth.
McCoy,
Aye.
Leighton and Warren,
Aye.
Becker,
Aye.
Smith,
Aye.
Welch,
Aye.
Warren,
Aye.
Vanden Heuvel.
Aye. Motion carries 7-0. All right, thank you, Josh. All right, that takes us to item number 5, committee meeting reports, and we'll start with the Education Committee, and I will turn it over to Committee Chair Andrew Becker.
Okay, thank you. Well, the committee also met tonight prior to the board meeting. This update is on the November 22nd educational committee meeting, and we went over the process of continuous improvement, and we heard from staff about what the various support departments do in relation to the schools, and what kind of instructional practices we do, how teams work together, the importance of building teams working together to suggest changes. And then we heard from several different participants about the continuous improvement, about the importance of focusing on a couple of main goals per building at the building level, while we have more at the district level. And also talking about culturally, linguistically responsive teaching, and our highlighted schools that presented to us were Sullivan Elementary and Washington Middle School. Anything from committee members to add from last November, or anything from staff to add? Okay, then that concludes the report.
All right, thank you, Andrew. Now we'll move on to the Operations Committee, and the update will be from Operations Committee Chair Dawn Smith.
Thank you. We had 2 topics on our November Operations Committee meeting. The first one, we got an update on the Federal Child and Adult Care Food Program and the Seamless Summer Option Program, which is a program that is USDA extended program that Green Bay is participating in, that will provide students in our schools with free meals. There's an attachment in the board docs that Lynette had put together with all the information on it. But we got a really good update. One of the things that was called out in our discussion during that meeting is that food service has not added any additional staff since the start of the pandemic. I didn't write down the number, but how many did Laura or Nancy, do you remember the number of meals that we've served? I don't know that.
I was just looking it up. No, I don't, but it is an enormous number of meals.
They're currently hiring too. They've got need, and they're trying to hire, but it's been a real challenge. So they're basically producing so many meals, and they're pretty radically understaffed. That was the impression I took.
Yeah, I know. She said at the time of the meeting in November, we had 6 open 9-month positions for food service.
And from an FTE standpoint, they're set the same or lower than where they were when the pandemic started?
Yeah, they have not added any additional headcount since the pandemic.
Oh my gosh.
So it was a good update, and they've been rock stars through this whole thing. So it's not a long attachment, but you can go through and read it, get more information on the program, but it was worth it. And then the other thing we talked about was the facilities master plan. And Steve kind of walked us through that whole document. We met last week, and was that last week? It all runs together. Sorry. I think
that was last Monday.
I think we met sometime, and we met with two different vendors who had sent in requests. Well, there's requests for qualifications. And Steve provided us with, and that too is attached in both the operations committee meeting and in the board docs for tonight. But really what the facility master's plan is, why we need the facilities master plan. And that was really just setting us up for those meetings last week with those two vendors. At some point, I'm assuming we'll be talking more about the vendors and the feedback that we had from that. So are there any questions? Awesome. Thank you.
All right. Thank you very much. All right. That takes us on to item number 6, which is just a point of discussion. And I'll provide a little bit of context, and then I'll hand it over to Laura, and then the rest of the board members can weigh in. So every week, Laura, myself, and Steve meet to discuss any happenings, set agendas, those types of things. And one of the things that we had talked about was some trends that we were seeing, certainly around the state and around the country, about the impacts that the pandemic has had, not only on our families and students, but also on our staff. And Laura, maybe I'll hand it to you, since you kind of had the initial idea, and then we can have an open discussion with the rest of the board.
Thanks, Eric. I'm going to assume that all our board members have heard either from staff directly or through various ways about the stressors on our staff, all of our staff in every capacity. And so I asked Eric if we could please put this on the agenda to talk about it. I mean, the COVID has added such a burden to our staff, and it's just really come at a huge cost to our workforce. And one of our guiding principles is a thriving workforce, and this is something that guides our work. So I just wanted to. I felt like it was time for us to have this conversation. I know that morale is low for our staff. The conversations I've had have been kind of alarming, and so I guess with the accumulation of these stressors and the chronic teacher shortage, and it was just critical. We've reached kind of a critical point. So basically, I'm asking that our staff address this and bring recommendations forward back to the board with as much urgency as possible, and hopefully by January. So maybe some short-term goals, maybe some long-term goals as well, and see what we can do to help our staff feel heard and to also take genuine action.
That kind of summarizes the conversation that Laura and I had with Steve. Any reaction or comments from the rest of the board? Don?
Steve and I had a conversation, and one of the things I had been thinking about, I saw a post on Facebook about a district that was offering mental health days to their staff. And Steve and I had a conversation about sick leave. And I don't know if it's called sick leave in the district, or it's called sick leave in the district, and really possibly looking at that and changing it from sick leave to something else and calling out appropriate use of that, including mental health. Just acknowledging that mental health is a valid reason to use a sick day, but I don't want to call it sick day. We need to give that to Lori or somebody who can figure out what it should be called, but it encompasses more than just if you are physically sick. And I think we could acknowledge that mental health is a valid reason for using that time if needed, especially given the stressors that everybody is under.
Go ahead, Laura.
I agree with everything that was said. I know one thing is using personal time or paid time off, maybe an option. I think given the circumstances everybody's been dealing with, this is very important. I think sometimes it's, it's nice to have the option to call in well. Maybe you have somebody, a friend in town, a family member, somebody you haven't seen because of this pandemic, and you just really need that time last minute. And I think personal time is something that employees are granted, they're entitled to use, and it's not really required to know exactly why. So when they're calling in sick, it shouldn't have to be for that. And I think this is something that I would support coming back with as soon as possible. I don't know what the options are. I think, in March 2020, teachers are heroes. They're coming in, and the sentiment was they're working with, without any notice and doing virtual. And then, this is pretty anecdotal, but then it was teachers don't want to go to work. They want to stay home. They don't want, and it's like, how does that switch happen? And additionally, teaching in classroom and then teaching virtually are two completely different skill sets. I know from just even doing meetings virtually or doing different things. So it's been a huge burden on everybody, and considering that we're concerned about the children and our teachers, I think this is a great idea to bring this forward. I know everybody, I think, has talked about what can we do to support teachers, our administration, everybody's feeling it. So I would support bringing something back as soon as possible and coming up with something that's going to help to engage teachers, because that's better, happier, healthier teachers is better for our students.
So a couple of things that I will share. I don't disagree with either of the comments that you made. One of the things that is unique about education is that when somebody in many positions calls in sick or takes a mental health day or isn't there, somebody needs to fill in for them. Right? If I don't go to work for the day, my work just doesn't get done and I get caught up. If you're a classroom teacher, that's not the case. And we know that all of this workforce shortage that we're talking about also applies to substitute teachers. So yes, and if we have staff that are taking mental health days, what that does is put a burden oftentimes on the other staff, which then becomes a hamster wheel of now the staff that are covering lose their prep time or have to cover something else, and now they become more burned out. And so, and I know, Steve, you and your team know that. So just as I think about this, in terms of timeline, when we first had this conversation, we said, maybe January, maybe February. And to Steve's credit, he said this is something we probably need to take action on sooner rather than later. So we'll bring this back in January for some feedback. Want to stress that I know we've heard the feedback, hey, we're sending out too many surveys. I want to stress that this isn't a survey. This is us trying to get suggestions, right? Around this table, we could all come up with what we think is the best answer and vote on it and go, but if we don't know, if we don't get that feedback. So it'll be a quick turnaround. It'll be open response. It'll be anonymous. And we want people to be able to give us those ideas so that we can weigh in and have some input there. And then obviously we'll probably get some suggestions that we simply can't implement, that there are other rules or regulations, whether they be state or federal, that we can't do. Some things we'll probably be able to implement immediately and take action on. Other things might be long-term projects. Tonight at the education committee meeting, we heard about the calendar, and they say like, hey, half days aren't that great for anybody. So we made a big step to get rid of some of them, and it sounds like we're going to try to get maybe rid of more in the future. So those types of things might be longer term projects. So go ahead, Nancy.
I think that, the pandemic certainly messed up everything. But then I think we didn't take into consideration how to pull back on some things. And I think we just kept going. And so all these meetings that I've gone to and stuff, we talk about all the teaching of teachers and all these meetings and things and so many new initiatives. I think we really have to pull back on some of those things. And if that's something the teachers ask for, I think we really have to look at that very carefully.
I totally agree with you on that. One of the things that one of the things that is a common theme from the things I've been hearing is time. How do teachers use their time? They don't have enough time. There's this like an arching theme throughout a lot of the struggles that teachers are experiencing is this they're giving up their prep time. They're not getting lunch. There's that constant stress about how they spend their time. So, can we maybe take some assessments off? Can we, have less meetings? Can we, there's things like that. So, anyway, I'm ready to have this conversation, and I feel like it's time to do that.
So, Steve, just to summarize, make sure that we're all on the same page. If you and your team could gather some feedback from the staff with the point of getting some ideas on what we could take off of their plate. Again, whether it's short-term temporary for the remainder of this year, or even something long-term that we can adjust to. And if you could bring us that feedback in January, the board can consider it and decide to take any action on it. Does that sound okay? Everybody good? Yep.
So I also wanted to add, when you brought up, Eric, about the shortage and how that does create a burden, I think something else to think about is how do we reward the teachers that are, they're not taking their time, or, when you're dedicated, you're like, oh, I can do more. You pick up, and you might be the one that needs self-care, but you're not. So how do we, as an organization or a district, how do you make sure that those teachers that are not able to take that time off, or may not be taking the time off, or they're always there, so they're the ones filling in for somebody else, just to make sure that that's the other side of the coin, and make sure that we're taking care of the people that are always there and going above and beyond to make sure that we're taking care of them as well.
Absolutely. All right. Thank you for the discussion, and you can expect to see that as a potential action item on our January 10th board meeting. All right. Oh, go ahead, Brenda.
I just wanted to address one thing specifically, because we did get an email this last week asking why we couldn't just, give the whole district mental health days and things like that. And I know Vicki addressed this at our education meeting, but just to bring it forward again, one of the challenges with that is that we're required by the state law to have a certain number of minutes. And so districts that are giving days off are going to be having to add that somewhere, whether it's removing spring break or going further to, more into the summer. So I just want to make sure people knew that that's why that wasn't laid out on the table as a potential solution. Because I know I think you told us the teachers union wasn't interested in having us go deeper into the summer. They were, hoping we could come up with things that would help during the school year.
And just another extension on that, I know that some had asked, they thought that the waiver applications that were available through DPI might include some hours and minutes like they did last year. And in meeting with the DPI on a regular basis, one of the things that they shared with us was that they are very unlikely to consider any request for a waiver in hour and minutes. Their first response to you, if you did that during the year, would be what would prevent you from adding those days to the end of the school year in June. So then that precipitated the conversation. We reached out to folks inside the district, including the association, and said, if we did this and this happened, where's the balance on that? And again, there was that concern about literally perhaps running into the third week of June if we started considering those options.
I remember that we didn't really allow a lot of snow days this year in our schedule. And some of these districts are allocating some of those snow days to days off. And that would be nice, but we don't have them. So, I think don't we have just like a couple?
Two, I think.
Yeah, so that's pretty lean.
Yeah.
We might not use them, but we don't know that yet. It's only December.
Yeah, I did see that from Oshkosh. They announced that they were converting some of the snow days, but they had 6 snow days in their calendar, which means that if they didn't have snow days, they would go to school 6 extra days than they had to. They converted some of those to just regular scheduled days off. So probably not an option for us because we only have 2 and chances are we're going to need them.
We've never had 6 days since
No, I know.
Maybe you have and maybe Andrew remembers, like, I don't know if we've ever.
There were some cold days.
If we've ever had more than just 3 or 4.
We've had 6 snow days, but not that were built into the schedule. That was, I don't know, a couple of years ago, we had to make all those minutes up.
That's correct. It was 6 or 7, Brenda.
Yeah.
That we had in 1 year.
Including one in middle of April?
That's right.
When we thought we were done.
We got hit pretty hard in January.
Yeah.
All right. So much more to this conversation. We'll probably have a lot to consider, but please encourage staff to take the time to put their ideas in there, and we'll get that feedback back presented to us on the 10th. All right, moving on to number 7, discussion and posted for potential action, pandemic update. A couple of different items here that we'll try to stay on topic with as we go. So letter A is current status, procedures, and next steps, and I'll hand it over to Superintendent Murley.
Great, and I've got other members on the team here who are certainly welcome to join in. So as you know, if you follow along, and as was referenced earlier in our community comment, we have a dashboard that tracks our activity in the district. You can see that if you click through on that link and shares with you essentially where we've been since the start of the pandemic. It contains information both at the aggregate level with the district and also disaggregated by building level. One of the things that you'll recall when we discussed this back in August was how we aligned with the CDC recommendation. And at the time we looked at their full slate of mitigation factors. We still continue to work with those. So think our heating, ventilation, and air conditioning system, physical distancing at school where possible, hand washing, and we continue to do those. 2 of the items that are on that slate of mitigation factors that the CDC has in place that we would like to discuss further tonight are our quarantining processes and our face covering. And as we look at those, just from an overview standpoint, before we dig into them a little bit deeper, just a reminder that our quarantining process does follow that CDC guideline. We have been monitoring and tracking that and have some feedback for you. And then again, our face covering also continues to follow that CDC guideline. And as we look at that, the one question we're asked on a regular basis is for how long? And so we hope to address both of those items tonight. Before we go on, Josh is at the table with us. And from a current status process and our procedures, I'd ask if Josh, and I think Kristen is online with us also, I'd ask either of them to chime in, and Heidi is here also. Anything on the current program that we should share with the board this evening before we talk about some of those details?
Sure, I'd be happy to get started. Currently, any close contacts that are a non-household contact, so we're thinking classroom, sporting activities, they were at grandma's house and grandma's positive, but now they're back in their own house, is a 10-day quarantine from that last contact with the person that was positive. Household is 20 days because that person that's positive in the household sheds that virus for a full 10 days. So they're constantly being exposed to that. And then we're using the 3 foot of distancing as recommended by DHS and CDC within our classroom because those kids are masked and we're able to measure out those seats. So we're pretty tight on those guidelines.
Josh? All right. Heidi, is there anything you'd like to add?
Nope, I think Kristen covered it. I think, is Josh going to talk about our numbers?
Yeah, I guess I can talk about numbers. You'll see in the agenda, the link to the dashboard that Steve referenced earlier. I do want to point out that we did have one slight change in our quarantine policy for close contacts over the course of the year. And that was not quarantining siblings, right? Kristen, would you remind us what that change was?
Absolutely. So what we did is when we first started the school year, we were sending home siblings as soon as someone presented with symptoms of COVID. And we stopped doing that in early October. And again, really saw those numbers drop down with those quarantine. And then once we had a sibling that was positive, we then contact traced out that household.
Thanks, Kristen. And that's evident if you do check out that dashboard. There's a chart for student quarantines and isolations, and you can kind of notice a big drop in quarantines, which are the blue bars for students once that change was made. We are honestly probably coming out of our worst period in terms of actual student infections. And that is in line with county data, which you'll see at the very bottom of the dashboard. Just a lot more positive cases recently. So I think that's all that I have right now, Steve, unless there are specific questions.
So maybe we'll open up for any questions you might have on current practices before we move on to proposed changes.
Doesn't look like it.
All right.
Going.
So the first one that we have for you, which we'd like to discuss, and I should also mention that in a previous board meeting, we get Dr. Hoyman with us, and she's back with us, and I'm going to invite her on here in a moment to talk about the changes as we look at those and perhaps answer questions that you might have. The first one is for quarantines, and one of the things that we have been looking at is the data as it pertains to kids who have their close contact with non-household members who are asymptomatic. And what we found is that many of those kids stay healthy. They do not wind up subsequently testing positive. And therefore, as we look at what the next steps are for us as a district, we would like to have the discussion about changing that quarantine status for asymptomatic non-household contacts for students, where we would not require them to quarantine as we do at this time. And perhaps before I go any further, let me first ask Kristen if you or Heidi have information to add to that, and then perhaps we'll invite Dr. Hoyman to join us.
Yep. So one reason that we started looking at this is we do have even lower numbers than our guest speaker had mentioned earlier. We're at about 2% for student positivity within our classrooms, which is quite low when you're looking at our numbers that are out. I think our distancing and our masking have made a great big difference with able to keep those numbers down.
And of course, the other thing we need to mention is that now ages 5 and up all have the ability to be vaccinated, so that changes things a little bit as well.
And Dr. Hoyman, welcome back. We're pleased to have you join us at the table again here. And I would invite you to offer any thoughts or feedback you have on quarantining and next steps for us as a district.
I thank you for inviting me back and allowing me to be a part of this meeting. I would support what you're discussing and recommending for the COVID positive person and a non-household member that's been a contact, especially with that low percentage rate of turning positive. I think, to be honest, the masking is probably what's helping you in a significant way here. And if you can keep the masking going, I think that that's going to allow this percentage to stay low. The thing that's going to help even more than that, though, is getting all those kids that are 5 and up vaccinated. So I would strongly encourage the vaccination status. Or vaccines for the children.
Laura, you have a question? Go ahead.
Dr. Hoyman, welcome back. So I think it's probable that people who are watching this, parents with students in our district, are looking out to the future, in the near future, and wondering about the variant that's heading our way. Some of the numbers in the UK, like exponential growth. It turns out, from what I can tell, and I don't know if you agree with this, the cases with the new variant are maybe not as severe as Delta, but and I'm asking you to speculate, I guess, a little bit. But what do you see this new variant? What kind of impact would you say could have on our district, or any district, frankly? I'm personally concerned about it, and I just wondered if you can offer any insight.
That's challenging because we're still learning a lot about the new variant. I think that what I would say before I even address that is that the percent positivity in Wisconsin continues to go up. And the majority is the Delta variant that we know of. I mean, we're at 16% in the last 14 days, which is high. And I mean, our hospitals are stressed. I hear you talking about your teachers and how stressed they are. We're stressed in healthcare as well. And we're having record number of hospitalizations because of COVID. Just last week, we hit record numbers for 2021. And they're just continuing to go up. Our ICUs are full. Every day, we have to look at the census of the hospitals, and I'm at Bellin, but it's every hospital looks at their census for the ICU, for the floor, to decide if they can do the surgeries that are needed for that day or that are scheduled for that day. Obviously, we can do the surgeries, but we want to make sure that we can keep them in the hospital if they're needed to be there too. The ERs, emergency rooms, are at over 100% capacity. Our urgent cares across this area are backed up. There's long waits for them. We're definitely challenged in the medical area. Then add on to it the quarantine and the isolation for our healthcare workers when they are either dealing with COVID themselves or are exposed. Each of the hospitals in Brown County has had to go on diversion at one time or another, which means that we've not been able to accept patients at that time. We also know that our nursing homes are dealing with COVID as well. And I bring that up because that makes it more challenging for us to get some patients out of the hospital that we need to transfer to other places. So it's definitely creating more problems. With the Omicron variant, there's a lot we don't know. We do know that there has already been a death because of it. There is speculation that it may be less virulent. I think that it's just really too early for us to tell you that. I don't want anybody to get sick. So I don't want anybody to get COVID, whether it's a virulent strain or not. The woman who spoke earlier about and made the comment that all 100% of the students in the Green Bay district that had COVID are all back and recovered 100%. I really hope that is a true statistic, but I'll be surprised if it is. I'm not going to lie, because we do see kids dealing with long-term problems from COVID as well. And there's lots of long-term symptoms that they've had. So I think that, you know, as we learn more, we're going to be able to teach you more about this. It's definitely a COVID, it's contagious, so we know that. And it seems to be a little bit more contagious than some of the other variants that we've had in the past. But predominantly here in Wisconsin, we're still dealing with Delta. So that's what I can tell you, what I know so far.
Thank you.
Dr. Homan, I have two questions. One, maybe you can speak to this or not. When you talk about the hospitals and emergency rooms and at capacity, are you seeing that a majority of the people who are being hospitalized for COVID being those that are unvaccinated?
Yes.
Or not? Okay.
Yes. I will tell you that we have patients that have had vaccines who have been hospitalized. By far, the majority of patients hospitalized are unvaccinated. The next, for COVID, the next group that are admitted for COVID are vaccinated, the next group, but they may not have their booster and they're well beyond the 6 months from their booster. So number one, those unvaccinated are super high risk, and those are the ones that are filling up the ICUs, the unvaccinated patients. But if patients don't have their booster and they are vaccinated, they're at risk too.
Thank you.
But by far, unvaccinated take up our COVID spots in our hospital.
Okay. The other question that I have is, can you help me understand the difference between a pandemic and an endemic, and how are we close to that, or what triggers that? I'm just curious because I hear, people will say, well, COVID's never going away and we're never going to get past this. It's going to be a part of our lives. I'm just curious your response to that.
Well, I mean, the pandemic the whole world is dealing with it right now, right? So we're going to see COVID for a very long time, and we need to coexist with COVID. But I think that if we can get more vaccinated patients, more people to get vaccinated, we're going to see the ability for us to control the more virulent strains of this, and it's going to make it not so severe for us. So I think, that's my big plug, is to get vaccinated as soon as possible. And if you are vaccinated, if you haven't had your booster, please get it tomorrow if you're 6 months out for sure.
Okay, thank you. Go ahead, Brenda.
Dr. Hoyman, I know one of the things that people will throw out is COVID is just like the flu. And can you describe during the flu season what the hospital situation is in terms of ICU bed and inpatient bed availability, even during a bad? I know last year there was almost no flu because we didn't spend any time together, but years past, there have been times when the numbers have been higher.
Yeah. Well, COVID can cause so many different symptoms. And I think that's what makes it so hard for everyone is We have patients that are asymptomatic. We have patients that just come in with headaches, stomach aches, cough, cold symptoms, diarrhea, vomiting. Really, the symptoms, it's challenging, and we have to have it on our mind all the time when patients come in. So the flu has many of those symptoms as well. And some years are worse for the flu. Last year, we didn't see much flu at all because distancing and masking works. And it's, I haven't been sick for a long time, knock on wood, because I mask everywhere I go. And am masked at work as well. So I think that, it's really important to remember that the flu, many people can get over too, but there are complications that come from influenza, and we are already seeing influenza in our region. We've had both influenza A and influenza B being positive in patients. So if you haven't had your flu shot, please get that as well. But we don't typically see patients hospitalized to the degree that we are with COVID at this point with influenza. So influenza positive patients definitely can get hospitalized, and they definitely have complications, but they don't take over our ICU the way COVID has been doing. So this has been much more challenging for us to deal with. Now, if you think back, and some of you may be young enough that you don't remember, but H1N1, when that came on, that hit us really hard several years ago with influenza, and we had a lot of sick people. But even then, we didn't have the ICUs overtaken the way they are now.
Right. Any other questions for Dr. Hoyman? All right, Steve, I'll hand it back to you.
Excellent, thank you. So if you look at the attached motion, I'll walk through this and stop as we go through just to make sure that if there are questions, the team can get those answered for you. And I'll read it as we walk through. That effective December 14th, which would be tomorrow, quarantining of district students for COVID-19 purposes shall be in accordance with 1, the December 14th, 2000 quarantine protocols as presented. So let me stop now, and we'll drop down to the chart. And again, I'm going to welcome my team members to jump in here. So as you look at the chart, you'll see that there are 3 columns: vaccinated, asymptomatic, unvaccinated, asymptomatic, and then all symptomatic cases. So in this case, if you are vaccinated and if you are asymptomatic, there is no requirement for quarantining, testing, or and then just you're simply monitoring for symptoms. Okay. If you are unvaccinated but asymptomatic, again, no quarantining, no testing, you're monitoring for symptoms. If look over to the left-hand side there, your close contact was with a COVID positive person who is a non-household member. You run into this in a community, a club, an activity, something else, right? And then if you drop down to the next row, if your close contact is with a COVID positive person who continues to live in your house, and that's staff or student, then we would still keep in place that quarantine for 20 days, returning on day 21. There is the possibility to take a lab test after day 16, which allows you to return after day 18 if you're negative. And again, those test results will be shared with the school nurse before returning for validation. We are continuing not to use at-home testing. Keep in mind that there's been much conversation about this at the national level. One of the things that we know is that people who use them at home have a tendency to cross contaminate their home tests, and so they just simply don't carry the same accuracy that the PCR test does. And so we're asking for that PCR test as the validation for that. And then finally, over on the right-hand side, all symptomatic folks, that's anybody who's suffering from those symptoms. If you've been out on our daily check-in, you know that it says, do you have one of these? Do you have 2 of these? And so it's looking for the symptoms that are similar to those that were described earlier. And if that's a non-household member, that top right-hand cell there, we're looking for that PCR test. We're asking you to quarantine while you're awaiting the results. If negative, you return to school and the symptoms improve. If positive, you isolate for 10 days. Bottom right-hand side, again, this is the household close contact. We're asking for the test and quarantining while you await the results. If the results are negative and you're fully vaccinated, then you return to school and the symptoms have improved. If you're negative and not vaccinated, not fully vaccinated, you quarantine for 20 days, return on day 21. And then finally, if you're positive down there at the bottom, you isolate for 10 days, return on day 11. If you refuse to test, you quarantine for 20 and return on day 21. So Kristen, Heidi, Josh, those of you that were with us when we went through and tried to make this hopefully as straightforward and simple as possible, is there anything that I've missed there?
I think you hit it all.
All right. And I'm just going to go through the whole motion and then we'll see if there's anybody else on our team or Dr. Hoyman that needs to add anything to it. Number 2 on there is determined by district health professionals based on the level of COVID-19 transmission in a classroom, a co-curricular activity, or amongst an identified group of students. And again, we still want to be able to defer to our health professionals if they determine that there is a need for a quarantine within that group. Similar number 3 is determined by the district health professionals based on adherence to other district COVID-19 mitigation measures in a classroom, a co-curricular activity, or amongst an identified group of students as presented be approved is at the end there. But the idea there is that, remember, we have many mitigation strategies in place. Our goal is to meet as many or all of those at all times. That does not always occur. And so again, we'd reserve that right for our school health professionals as they look at individual instances to consider quarantining for students if we're not able to meet those mitigation factors. So Josh, Heidi, Kristen, anything on those 2 that we would need to add for the group here?
The one thing that I can think of is for our early childhood and 4K classrooms, we are still going to continue to contact trace those rooms because those children are not eligible for the vaccine yet. And we know that they are in very close quarters at all times because it's really more play-based learning. So there's no distancing going on there.
Thanks, Kristen. Andrew?
Go ahead, Andrew.
So I certainly think it's reasonable. I still have and the improvement on at least some improvement on the 20 days is good as well. It's not much, but it's something. And certainly the no quarantine options for vaccinated asymptomatic is good. I'm wondering where does 2 and 3 kick in though, that where option 1 doesn't apply? Because we're going to get questions about, did you approve a motion that says this chart applies unless district health personnel choose to override it?
Sure. Sure, Kristen or Heidi, perhaps if you can think of some examples that might help maybe make that number 2 or 3 a little bit more concrete for the board.
One thing that I can think of is when we're looking at a classroom and we're hitting that 20% positivity within a classroom, that would be a time where we would do contact tracing, possibly still shut down that classroom depending upon what that scenario looks like.
So then what would be a case of number 3 instead of number 2? Like I get 2 easier than I get 3 because 2 is, okay, a high percentage in a classroom are positive. That's pretty easy to understand.
Let's say there is a overnight field trip and we've got kids that are in the same room together. They're in the same room together because it's a safety issue. We don't want kids alone. And one of those children end up being positive. So now you've got somebody that spent an entire night together, almost like a household type situation, not where they're close together for a half hour here, half hour there and masked, because we know they're not going to be masked when they're sleeping. So a situation like that would be an issue where we might end up close contact tracing those roommates in that situation.
Okay, so then when would it apply? Then why does it? So I understand that as far as co-curricular activity or a certain specially identified group of students, but where would number 3 apply to a classroom where number 2 didn't apply?
I can jump in just real quick. We still have field trips that are taking place, and we anticipate that, especially as we move around the corner into the new calendar year, that where possible, we are trying to restore as much of the normal school year for our kids as we can. And some of our students do go on overnight field trips, and so that would be a curricular activity as opposed to a co-curricular activity.
Okay.
Brenda, do you have a question?
Based on what Dr. Hoyman said about the booster, what is our definition of fully vaccinated?
We continue to use the CDC guideline, which says the 2 shots. We know, and Dr. Hoyman did a nice job talking about the impact that the booster does have, but at this point in time, CDC still says it's the 2-shot regimen, and so we would continue to go with that.
That is what we use at Bellin as well. Right now is the 2-shot schedule, but strongly encourage everybody to be boosted. Currently, the booster has not been approved for under 16 either. It just got approved for the 16 and 17-year-olds.
We do track the booster. We do track the booster dates if they're offered to us in case that definition changes down the road. Just wanted that on the record.
Can I ask a question about the bottom right box? So when obviously that's close contact, or that's a positive person lives in the student, staff, or home. Does that also include that the student in this case would also have symptoms? So the student has symptoms and somebody in their house is positive?
That's correct. You'd have, again, the student is symptomatic, so that's our top row there. Yep. And then the person who they have close contact with, that household member, is positive.
Okay. All right. Because I know, so if negative and fully vaccinated, they can come to school when their symptoms go away. If negative and not fully vaccinated, then they quarantine. If that test comes back positive, now they're just on their own 10-day quarantine.
They're isolating then at that point in time.
Sure,
because
they've tested positive, and the person that they live with is no longer relevant.
Right.
Okay. Okay, thanks. I was just getting, because there was 2 people there with positive tests instead of 1. So,
and maybe one thing to note, and it goes along with what Dr. Hoyman shared, and certainly what we're encouraging with folks, is if you look at that asymptomatic component, in both cases, it says that if you test and that test is negative, that when your symptoms improve, if you're vaccinated, then you're coming back to school. So that could be a relatively short period of time, depending on the severity of the symptoms that you have.
Go ahead, Laura.
Could you explain how, if at all, does this change the contact tracing that is currently done? Is it different with this proposal?
Kristen and Heidi, you want to jump in on that?
I can jump in on that. So it will change things from the standpoint of we will still have kids on quarantine, because any child who is ill with symptoms of COVID-like illness is going to be home on quarantine until we get that test done. But as far as the actual contact tracing goes, one of the things that I have found works very well for athletics at this point is I'll just send home a notice to those parents saying, hey, there was a child on the team, or not necessarily even a child, not call that out, potential exposure. Please be aware of symptoms for your child for the next 10 days. So at least it gives them that awareness to pay attention to anything that their child might be experiencing it. We've talked about, sending home class letters. We do know that they can tell by the school where, parents watch those closely. They've been numerous contacts with different parents because they're saying, oh, my school is now up to this many percent, or my school's at this percent. So they're watching those numbers also, and we're happy to have those conversations with them at that time.
And for context here, we're currently sitting at 861 student quarantines. Probably about 250 of those quarantines fall into that bucket of asymptomatic, non-household close contacts. So the remainder would either be household contacts or they're symptomatic awaiting the results of a test.
But parents would still be notified if, like you said, the letter that goes out, or I've had to quarantine my child twice. So just because of close contact. So parents would still get that notice if they had a close contact, but the amount of time quarantine would be changed. Is that correct?
I think what my thoughts are at this time and what we've discussed is not sending home that global letter to just that core group. It would be in larger context of in the classroom, or it's hard to do in middle school and high school because those kids are so active and moving all the time. But, looking at alternative ways that we can let parents be aware without having to spend all the time contact tracing. And we know that there's not a lot of kids testing positive. I mean, that are within the classroom, those close contact situations. The masking helps, the hand washing helps, our distancing, those types of things.
So I have a question. If this passes tonight, what does that do to those 250 students who are at home without symptoms?
Great question. So we would start tomorrow with the new protocol. And then our health team would go back and look through the students that are currently on quarantine to determine how the new rules will be applied to them. And then as quickly as possible, we would start to try to return students who would not have been quarantined under this current motion that were quarantined under the previous motion, so that we can work on getting those kids back to school as soon as possible.
But this doesn't apply to 4K and Head Start.
Correct. So our 4K and Head Start students at this point in time are not eligible for vaccines. So if you think about that chart and you look at that, in the vaccinated asymptomatic, they're not going to fall into that category. So we're going to continue to treat them in that unvaccinated, either asymptomatic or symptomatic category.
And just historically, this whole school year, 4K and Head Start has been the biggest challenge, probably. Those kids crawl all over each other.
Yeah. Okay.
Dr. Hoyman, is there anything that you'd like to add before the board considers the motion?
No, I think I would support this. And I think the only thing I would continue to add is that masking makes a difference and vaccination makes a difference. So we have to continue to encourage that in everybody. And we are definitely seeing higher numbers of positive children in the community than we have in the past. So they're definitely increasing.
Thank you.
All right, then I would look to see if there's someone who's interested in making the motion that is. Yeah, I don't think we're done with her yet. Is there someone?
I move that effective December 14th, 2021, quarantining of district students for COVID-19 purposes shall be in accordance with 1, the December 14th, 2021 quarantine protocols as presented, 2, as determined by district health professionals based on the level of COVID-19 transmission in a classroom, a co-curricular activity, or amongst an identified group of students, Or 3, as determined by district health professionals based on adherence to other district COVID-19 mitigation measures in the classroom, a co-curricular activity, or amongst an identified group of students as presented be approved.
Second.
Any other discussion? All right, Beth, we're set to vote.
Online voting has been opened. All votes have been entered. The motion has carried with all board members voting in favor.
All right, motion carries 7-0. We'll move on now to C, rescind of prior face covering motion. Steve, I'll hand this one back to you.
Great, and these actually go together. So we would propose a new motion coming forward on face coverings. However, prior to entertaining that, we would need to rescind the current motion so that this one can supersede it. So if you'd indulge me, I'd actually go through and talk about D, which is the face covering motion, and then if appropriate, you could consider C prior to acting on D.
Perfect.
All right. So if you look at item number or letter D, you'll see that we have a motion for you to consider that would again start tomorrow, December 14th. This would apply to face covering for all students, staff, visitors, and contractors. Shall be required inside all buildings and premises, and also on district provided transportation. Just an asterisk on that. Remember that we continue to follow the federal regulations when it applies to district transportation. The second item on there, that it would be optional when outside on district premises. Third, as determined by district administration for district student co-curricular activities, and that as such requirements, except as set forth in state or federal mandates, be discontinued when, and this is the change from the previous motion, COVID-19 positive cases in Brown County are at or below 100 per 100,000 over the course of 7 consecutive days, and that such requirements be re-implemented after discontinuation when COVID-19 positives again go in the other direction and exceed 100 per 100,000 for 7 consecutive days, or unless there's a spike and it hits 200 per 100,000 for any single day. And then we would simply cycle back if we wound up having to re-implement it after it was discontinued. Then we would simply go back and again work on that cycle when it hits below 100 for 7 consecutive days, and then we would again discontinue it. So that would be our metric moving forward. So the difference with that is what it does. If you look at item C on there and you look at the previous motion that was in place, essentially when we hit that number, that required that we had a special board meeting. Our thought on this is, knowing that that was the metric we used before, that we would simply move directly to discontinuing face coverings at that point in time. So questions that we can answer for you, and maybe Kristen, Heidi, Josh, anything you'd like to add to that?
Yes, I'd like to add something, and I feel bad that I overlooked this because I've read this dozens of times at this point. The metric we're looking at here is the 7-day rolling average of 100 per 100,000 over the course of 7 consecutive days. So the metric, when it says COVID-19 positive cases, that's the 7-day rolling average for the county. That is the chart at the very bottom of our dashboard. If you go back to the previous agenda item, check out the dashboard. Those that data is typically available somewhere between noon and 2 o'clock every day from DHS, except on the weekends.
So right now we're at 542. Is that correct?
Yes, it's not been going great.
But if you look at that criteria, we would have hit that back in, if I'm reading this right, back in February, and would not have had to put masks on until about August. And so we, this whole school year, have been above that rolling average of 100 so far, but we have been below that for 6 months. So it's, I'm just pointing out that it's possible to get there because we've been there before. And I think you can see from that chart the cyclical nature of the virus, which, you know, they told us from the beginning to expect that it moves through a community and comes back down. And you can see that looking at the country. You know, it used to be all dark down in the south, and now they're really pale, and you know the cases are in our community now, and so hopefully it'll follow the same pattern as it did last year, and we can get down to below 100.
And just to note, remember when I brought this back to you as a board and asked that we get this back on the agenda and we start having that conversation, that would have been in October. And if you're looking at that chart, you could see that there was some rapid improvement in that case rate in Brown County. And so that was at that point in time, we'd push to have this added to the agenda because we were hopeful things were moving in the right direction and we wanted to be prepared for it. Even though we're struggling a little bit right now in Brown County in terms of where the rates are at, again, we thought that now would be a good time for us to take a look at this so that we can clearly operationally define when we would move in or out of a requirement for facial covering so that students, staff, and family members would have a better idea what that looked like and when they could expect that. Kristen or Heidi or Dr. Hoyman, anything that you'd like to add? Thank you. Questions? Anything we can answer for you?
Oh, sorry. Go ahead, Brenda.
Can we just make a friendly amendment to put the rolling average in?
Sure. Yeah. I mean,
motion?
this is just a recommended motion, so you can read that differently. I don't think we need
We don't need to amend it.
It's just when somebody reads it, just put in what you want.
All right.
So if there aren't any other questions, I would go ahead, Andrew.
What do we know about differences between, I know we got the item in public forum suggesting that there's but without the full context, how different is it in surrounding districts? I know not all districts are the same, I get that, but what is happening in districts that have had optional masking at a far more permissive level than we're considering here? Are they having more cases? Are they not having more cases? Is some higher, some lower?
I was going to offer that I'm not sure we're qualified to answer that, Dr. Hoyman. I don't know if that's something that you can speak to directly, but I don't think that anyone on our team could speak directly to that without actually having access to some of that data inside those districts.
I can't answer that question.
Right. And the way the data is collected is just completely different too. I mean, the board just voted to do away with close contact quarantining, and we were among the last still doing that in Brown County, for example. Right. So we have a really rich data set. I'm not certain what that would look like if we didn't have the fantastic nurses doing what they're doing for us right now.
Well, I know, and I'm sure we do have much better data on like actual student case count. I guess what I was getting at is, given that most kids attend public school, right? If you go outside of the boundaries of the Green Bay district to places where there's a much more permissive masking rule, one might expect to see the ages, in the age brackets that under age 20 would have more because masking is optional, or is that not the case? I guess I'm okay with starting with the 100, but it might be a long time before we get there, especially if, and I guess I'm hoping half of this is right and half of this is wrong. I think cases will go up, but the new variant is likely to be less severe illness. So I think it might have to be revisited if it looks like it's a situation where we'll never get to 100, but people aren't, hopefully people aren't getting seriously ill or dying nearly as much. So I think it is worth, it's not the information isn't available tonight. I think it's worth a look though. And certainly a look to see if our numbers go up disproportionately if we hit a threshold where we're able to go mask optional. But it's a step towards being mask optional. And I looked at that too, that we certainly did have a period of time. Some of it was in the summer, but plenty of it was when school was in session too, that we hit it. And I think we even would have, I think we might have even hit it for a while after wave 1 too. Not that was maybe the time to do it. We didn't know enough yet, but.
Andrew, I would generally agree with you. I think that this motion at least puts some kind of a metric when somebody says, when are you going to, when do masks end? The fact that we I think I mentioned this last time in terms of trying things out, not doing the quarantines the same way. We'll see if that has an impact on things. It doesn't sound like, or it sounds like it will in a positive way, more kids in class, and shouldn't significantly impact our cases. And then, experimenting with that 100 number. I think that there's the one thing that we've learned through this entire pandemic is you can make a decision and then 3 weeks later, maybe it doesn't apply. And so this is a good step for right now. And certainly not the last time that we'll talk about this. Go ahead, Brenda.
Yeah, because one possibility is the Omicron, if it's less severe an illness, is that we might be at 200, but our hospitals have plenty of beds for surgeries and accidents and all sorts of other things. That's, to me, that's the hospital, how full the hospital is part of a decision, because even more now than safety, because people, except for the less than 5-year-olds, all have that choice to be able to be protected with the vaccine. But if we don't have room in our hospitals for a tornado that comes through and, we've got 100 people that show up with injuries and need to be treated and we don't have room for them, those kinds of things are very concerning as a community at large. I think we all want to make sure that something happens to someone we love, that they'll be able to be taken care of in the hospital. So to me, that's a huge metric in my mind that that helps guide my decision about what the case, it's the balance of the caseload. But if people aren't in the hospital anymore, then the caseload can go way up and we can take masks off that way too.
Go ahead, Steve.
I just had one more caveat just to make sure that everyone understands. So when you look at number 3 on there, and you'll note there's a clause except as set forth in state or federal mandates, just a reminder, not only does that include transportation, that also includes our Head Start program. So I know we talked a little bit earlier about the struggles we have with our 4 and 5-year-olds, the fact they're not eligible for vaccines yet. At least at this point in time, under those federal requirements, those students would still be masked. And that would happen even if we fell below the 100 at this point in time. That is still a requirement for them.
So we could be below 100, but all kids in the district on buses or all kids in Head Start would still have to wear masks.
Correct.
That's the federal mandate.
Correct. Right.
Okay. Any other discussion? Go ahead, Laura.
I think this makes me feel hopeful. I know, and talking with some parents, they just wanted sometimes something to look forward to, and this is putting that goal line out there. I do see some of the social media posts or different things that are stated about the other districts and their different things, but how they may handle this and the masking, and I think Green Bay is fourth biggest. And I mean, we're just, frankly, we're not the other districts around us. And I think that makes us great. I mean, nothing wrong with the other districts, but the diversity, the community that we have, and we have to make decisions based on what we need, not of what other communities are doing. And I understand the frustration as parents may share that, but I think that this is giving everybody something to shoot for, and also just doing what we have to do for our community, our schools, and our kids, and not comparing ourselves to other districts that have different needs, different populations.
Go ahead, Laura.
I just want to second what Laura just said. I get that there's an inclination, it's a human kind of thing to compare our district to others, but that actually, and pretty much everything in this area, we can't, it's not really, you got to talk about scale, you know, and all kinds of things. So it's not really, you know, I don't know that we should spend much time thinking about that. And also, I just really appreciate the calm questioning and answering, and just the hard work of our staff that they put into this. That it's really good to have this conversation and know that everyone's being respectful and taking into consideration each other's positions. And I just want to say I really appreciate that.
All right. If there aren't any other comments, then I would look for a motion on letter C to rescind our previous mask motion.
So moved.
Is there a second?
Second.
Any other discussion? Otherwise, Beth, we're set to vote on, oh, I'm sorry, Laura, go ahead.
Did we have to adjust the rolling? And
We will on the next one.
Oh.
Yep, this one is, so this motion here is just to rescind the motion that we made
Got
on
it.
August 18th, and then we'll go and, but good catch. So whoever
Thank
makes
you.
that one, we'll have to make sure to make the adjustment. Beth, we're set to vote on item C to rescind the prior face covering motion.
Online voting has been opened. All votes have been entered. The motion has carried with all board members voting in favor.
All right, motion carries 7-0. Moving on now to face covering motion. Brenda, do you have that ready to make that adjustment? Okay, go ahead.
Move that effective December 14th, 2021, face coverings for all students, staff, visitors, and contractors shall be: 1, required inside all district buildings and premises and district provided transportation; 2, optional when outside on district premises; and 3, as determined by district administration for district student co-curricular activities, and that such requirements, except as set forth in state or federal mandates, shall be discontinued when COVID-19 7-day rolling positive cases in Brown County are at or below 100 per 100,000 over the course of 7 consecutive days, and that such requirements shall be re-implemented after discontinuation when COVID-19 positive cases in Brown County exceed 100 per 100,000 for 7 consecutive days, or 200 per 100,000 for any single day as presented be approved.
Second.
Any further discussion? All right, Beth, we're set to vote on that.
Online voting has been opened. All votes have been entered. The motion has carried with all board members voting in favor.
All right, motion carries 7-0. Thanks, everyone. All right, moving on to item number 8, action item on the facilities master plan. Steve, do you want to just provide a little bit of insight? We obviously went through the presentations last Monday, but just talk about what happened between now or then and now.
Absolutely. So again, just for context, as we are looking forward as a district with a goal of developing a 10-year facilities master plan, that would be that roadmap for work to be done in the district, everything from new construction to renovation, The intent was to seek a partner as part of that process. As noted in the summary there, we came forward to the Operations Committee on November 17th, and then the board work session on the 6th to talk through that. We on the administrative side went out and developed a request for qualifications, placed that out in the general public for review. We had 28 unique downloads of that off the Bonfire platform. I answered many questions from potential partners following that release. We were fortunate that 7 of those entities that downloaded that then responded affirmatively and completed the request for qualifications. Our administrative team went through and evaluated those, looked at 2 that we determined would be best able to meet the needs of the Green Bay Area Public School District. We interviewed each of them separately to make sure that administratively we had a level of confidence that they could complete that work. Having gone through that process and made that determination, we then invited them in to present to the board. They were in last week. We did that irrespective of cost to start with, simply to look at the quality of the work that they would do and whether or not they'd be able to meet the needs of the district. Following that, we then solicited cost estimate from each of those firms. And following that, we went through an evaluation process to look at the cost, the return on investment, their ability to complete that. And then based on that evaluation, we bring forward to you tonight the proposal from ATS&R to come in and do that work for us. A reminder that that facility master plan provides the opportunity for us to look at all of our facilities, to evaluate them in terms of their current structural components and needs that they have to bring them up to a uniform specification level, to identify what alternatives may be available for us to make sure that we can best meet the needs of our students. That'll require extensive community engagement. So that was a part of their discussion and their proposal to us, is how they would help facilitate that discussion. The benefit that this brings to the district is obviously an objective third party that comes in, that's done this in numerous other districts and is able to bring to bear that ability to look at our facilities and provide us with that external review of the facilities themselves, and then work with our community to help develop recommendations that we can then hopefully eventually adopt as a board. That'll give us that roadmap that'll really help us decide what happens when and where and why. And we think that that will drive the work that we think will be necessary to support a referendum that people in the community will be able to get behind, because they will have been instrumental in developing that roadmap and specifying what the projects are that will be needed to complete that and when they will be done, so that when we go out to ask them for support through a referendum, they will have a concrete understanding of what it is that we will actually do as a district. So that's a real quick overview of what took a couple of different meetings to go through.
Go ahead, Laura.
I mean, I know the answer to this question, but there might be people watching who are wondering why we can't do this work in-house.
That's a great question. So we have a fantastic group of folks, whether that's in our facilities department, I think of our operational areas, food service, custodial, our ability to do demographic projections, those types of things. We struggle in a couple of areas there. First of all is bandwidth, our ability to do it, given all of the other work that needs to happen in the district at the same time. This is an enormous undertaking, and we simply don't have staff that can support all of this work. Think about Lori Blakesley, just does amazing work. She already has a full-time job, and to ask her to undertake the community engagement that goes along with this, in addition to all of the other work that she does, is going to be impossible for us to complete this. Certainly, she's available to provide assistance to them. She's got the contextual understanding of Green Bay, our community, and would be an invaluable asset as assistance in that process. Mike Stengel knows our facilities top to bottom. Bringing somebody in that will use an adequacy standard that is developed and applied across multiple districts gives us an objective analysis of how our facilities stack up and where our needs might be. Again, Mike's got the intimate knowledge of every facility in the district. He and his team would be instrumental in working with them. But we live here, right? And it's a little bit harder for us to assess our own house. This brings in somebody from the outside that can help us with that. Mapping it out as we get ready for that referenda. Again, bringing someone in who's gone through that process can help us make sure that we've got a calendar in place that provides a workflow that's manageable inside the district, that works with our teaching and learning program to ensure that we've got a smooth operation for kids even as we go through this work. So I think those are some of the benefits that we have from bringing in someone from outside to help us go through this process.
I would just add to that, I mean, people are sentimental about their neighborhood schools and all that, and are very attached to their schools and you know, these facilities that their children spend in, you know, years in, and that's great. But the impartialness, the non-bias aspect of this will be, I mean, just from my point of view, is a big part of the work. So.
Go ahead, Andrew.
Don't we have a rolling and frequently updated list of things that need to be done as part of a master plan? And is this just saying that isn't sufficient? I mean, don't we have an ordered list of things we need right now?
We do. We maintain a list of deferred maintenance projects, and so we know what the scope of those are. The one thing that we don't have is we don't have that baseline to measure those against, to determine from an educational adequacy standpoint what our expectations are for a student, regardless of their zip code, their address in the community as they walk into a school, and to be able to take every one of our facilities, every one of our classrooms and learning environments, be able to measure that against that type of adequacy standard, and then from that develop a very comprehensive list of not just those deferred maintenance items that we know need to be done, but also casting forward and thinking about those kids who are kindergartners this year. They're going to graduate in the 2033-34 school year. What kinds of things might we need to consider as we move forward for their educational environment so it meets the needs of today, but it's really prepared for the needs of tomorrow and beyond. So it's a little bit more than what we do now, in the sense that rather than just looking forward to next year, we're really casting out and saying, what are those projects that we need to do over the course of the next 10 years? So I would say, Andrew, that it takes what we have now and goes into more depth and provides a longer context for the work that needs to be done. I think that that's instrumental for us if we're going to go out and ask folks from a referendum standpoint to really cast forward and look over a long period of time in order to get that work done.
I have, oh, go ahead. Okay, I have one other question. The cover letter, which I realize isn't binding, but the cover letter says we are able to offer a lower fee knowing we would be used for some other upcoming work. What kind of like expectation is there of that? I mean, obviously nothing is true unless it's contracted, but there's obviously some expectation in what was written here.
So that was something we were crystal clear on from the outset. And to be honest with you, when I said that we had 7 responsive folks to the request for qualifications, we did have several firms that were very explicit with us and chose not to respond to the RFQ, because this does not include in it any obligation on behalf of the district to retain anyone for any services in the future. Our team knows this. I've been very, very clear in that. Those that responded to it also understood, and I was very clear in that with them, that the completion of the RFP gives us a roadmap. As we move through that roadmap, we'll have different projects. There could be new construction, there could be renovation and remodeling. Each one of those would go through its own separate bidding process and award process to ensure that we make sure we get the best value for the district for each project. Now, certainly, and that may be in there because I can tell you in a past iteration of this, I actually put a prohibition in there for those who developed the facility master plan from bidding on subsequent projects, because we simply didn't want to set it up so that they were perhaps seen as generating work from themselves. And so while I don't know for a fact, having talked to the folks at ATS&R, but I think what this does is it preserves for them that opportunity to bid on those projects when they come available. Maybe also to notice in the recommended motion, it says subject to contract negotiations and finalization. And that's certainly something that we can make explicit in that, Andrew.
Right. Well, so I just want to point out that in the cover letter, it says they give us two options, option 1 and option 2. Option 1 says there's no guarantee of any work. And for that, it's 149,000. And option 2 is you guarantee us that we're going to get future work. And that one is 99,000. So we're approving tonight option 1, which guarantees that there's no extra work. Nancy, did you have a question?
Well, I was just going to add that, isn't this information that we're going to get actually help us to plan, not just buildings, but I mean, the way the district is developing and where our schools need to be and closing and all those things too, right?
Absolutely. Having that detailed demographic analysis helps us understand where kids going to live in 1, 3, 5, 10 years, helps us understand capacity. It will allow us to engage in some pretty deep community conversation about what does an ideal elementary school look like, or a K-8 school. We know, and Melissa be the first one to tell you, I'm sorry, Lori be the first one to tell you that we have lots of information from our community members who have looked at things in the district that we've developed and said, hey, we really like that Red Smith idea. When do we get that here type of thing? And this gives us that opportunity to go out to the community and make sure we know what do they want. And then from that, it could alter what we consider as we move forward based on what we hear from the community.
We lost a year or two with COVID, but that survey is fairly recent, right? So we might tweak it, but I think it's got a lot of really good information, plus the boundary committee information. And yeah, so I mean, we started this, I can't remember the tagline of it. Redesign, that was it. Redesign 2020. Little did we know. But anyway, so we did start this process back in 2019, late 18, 19, I think. So yeah, we'll have a lot of that information to provide to the this company.
And that is something that we shared with folks as they came through it, that this isn't, we're not starting from ground zero, that this is part of an ongoing process, and that we've got additional data that's available to us, whether it's generated in-house or whether it's part of the processes that have been done. Either there was Redesign 2020, there's another plan before that. And so we've got a wealth of historical data that will help them as they go through the process and get us ready to go.
Go ahead, Andrew.
I guess for me, I'm sure these folks will do a good job. The bid was competitive and they were vetted. I look at the hundreds of hours on task force meetings, more so than I look at the part 1 about the facility and the educational analysis. And ultimately, when it comes down to the rule that I live by, that I have to be in 85% agreement with something, or I have to vote no, I would be there if we were. It's a significant project. I don't deny that it needs outside facilitation, but I think I could get to a yes if it were 80,000 or less, but at 150, I just have too many. I have too many reservations, although I do think they will do a good job.
All right. Any other questions? Otherwise, I would entertain a motion.
I move that the facilities master planning services fee proposal option 1 submitted by ATS&R is in the amount of $149,832, subject to contract negotiations and finalization as presented, be approved.
Second.
Any other discussion? All right, Beth, we're set to vote.
All votes have been entered. The motion has carried. The results of the individual board member votes are as follows. Vanden Heuvel, yes. Smith, yes. Becker, no. Warren, yes. McCoy, yes. Leighton and Warren, yes. Welch, yes.
All right, motion carries 6-1. All right, moving on to item number 9, agenda setting. Just want to point out we are scheduled next week, Monday, for a policy and governance committee meeting along with an operations committee meeting. We are then off for the holiday and coming back for a regular board meeting on Monday, January 10th. Any other comments? All right, then I would look for a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
Opposed? All right, that concludes our December board meeting at 7:55. Have a great night, everyone.
You have been watching the Green Bay Area Public School District's Board of Education meeting. Please visit the school district's website, www.gbaps.org, to view the program again. If you cannot fully access the information on this video, please let us know the accessibility issue you are having by calling 920-448-2025 or by email at communications@gbaps.org. We will try to provide the information to you in an alternative format and/or make the necessary improvements to make the information accessible.